So, Renata, I think um, are we
Oh
stopping at
my
11?
goodness. Yes, yes, we are. Oh my gosh. This is absolutely wonderful. We have so many questions. Can you guys hear me well? Do you guys like the new platform? I know we had up to 20 people on Instagram, over 40 people over here with us. So a record night. Thanks for everybody who is here. I'm gonna ask a few questions. Is that okay? Do you have about 5 minutes?
Yes, yes, of course. Sorry to go over time.
No, you're good. We started a little bit late. So um how are these appliances and protocols, here we go, different than the MyoManchi?
How are they different? The Maya Munchie, I mean, the Maya Munchie is, from my understanding anyway, I'm not an expert on Maya Munchie, so best to
Yes.
ask the Maya Munchie people, but the Maya Munchie, to my understanding, is primarily designed for chewing and teething, and it's got some bristles on it and so forth. It's probably the closest to our MyoChew appliance. The
Yes,
MyoChew
which my
has a
is my son's favorite. Benny, he loves this Mayo too.
Yeah. So I think Maya Munchie doesn't have the tongue press tube, so that's one difference. And Maya Munchie has from memory again. Please don't. I don't want to misrepresent Maya Munchie, but it has
Yeah.
a handle that the kids can hold. If that's is that correct,
Mm-hmm.
Renato? It's just a handle.
Yes. Yes.
Yeah. So one of the things the myofunctional therapists in Australia like is that the MyoChew has that strap tether, so that if the kids sort of they're chewing and not paying attention, if it falls out of their mouth, sort of so I'm not sure, Renata, you'll probably know better than I do. Does Myo Munchie have a protocol to use it, or is it just you put it in and start chewing?
They do have a protocol. Yes, you take their course. So that's a great question. They have a course that you can go through and you can become a myomantra practitioner. Do you guys offer something like that for myofunctional therapists with MyoBrace?
We yes and no. So these appliances that I showed you here, they're just like you guys have the expertise to use them. You know what I mean? You just grab them and start using them. But there are other treatment systems we have like MyOSA or MyAbrace and so forth that we do actually have an education program where we sort of train you up to use the entire system end to end. So that's kind of it depends on the system. That's the answer to your question. So it depends what system you want to use, is what we would train you in. But certainly, if you want to do our protocol of MyOSA for kids,
Mm-hmm.
the best place to learn that is our MRC summits. So if you come to our summits, we teach it then.
Okay. Very good. Well, if you have a list of the next summits coming up, let us know so we can share on every circle. One of my favorite doctors right here, Dr. Lupita Roca, she's saying, I always have my patients place the tongue inside the tongue slot relaxed, but the directions of the box say on the tongue tag. Can you explain what you mean by a tongue tag? Because they are over analyzing on the tongue tag.
Yes, that's a good question. Renata, is my screen still showing?
No, I can put it
Okay.
back.
Let me just find the appropriate. This is a good question. It's actually asked a fair bit. We get this question a lot from practitioners. Like, what do you mean by place it on the tongue tag? So I'm just going to use this graphic here because it's sort of easier to see. But when you place the appliance in your mouth, this is the tongue press tube. This is the TLJ. But if you use the MyOSA for Kids appliance, there's a little tongue tag that comes here. You want to be placing the tongue like under the tongue tag, if that makes sense. So you don't want to be placing it on top or in. You want to be placing it under. So when you place the tongue on the tongue tag, like oh, under the tongue tag, the idea is that when you then take the appliance out of your mouth, your tongue knows sort of goes for that position again, if that makes sense. So the patient goes, okay, that's where the. Do you guys call the end spot, Renata? Is that the end spot, the
Yeah,
correct spot?
and spot. Mm-hmm.
End spot. So that's where the
And
tongue
nah,
tag is.
nah, nah. Oh,
Exactly.
very
So
good.
when the tongue tags, if you have a look at the appliances, have a little sort of raised bump on them, and it just makes the kid's tongue want to go there. It's so they play with it a little bit, and then when they take
Mm-hmm.
the appliance out of the mouth, that's where the tongue wants to go because they then know where the correct spot is for the tongue.
Perfect. Next question. Can the TLJ be used by complete denture wearers?
Oh, that's a good question.
Mm-hmm.
There's no like I've never used it in a complete denture wearer just because we treat younger kids mainly. But off the top of my head and as a dentist, I don't see any reason why it couldn't. because it's a muscular training appliance and it's only used for about
Mm-hmm.
10 minutes twice a day. So as long as the patient
Okay.
can put it in their mouth and keep it in their mouth, they can perform all the same things, whether they have dentures or not. I'm I would probably be inclined, using my dental knowledge, I think I would tell them to keep the dentures in their mouth. I think that if they took the dentures out, the gingiva wouldn't be tall enough to retain the appliance. But you could try it with and without. Um, and the theory is the same regardless, though. You're squeezing the tongue press tube or you're squeezing the lip press tube. It's the same thing.
Awesome. Aaron White is saying, can we order these habit correction appliances as a myofunctional therapist and not as a dentist?
Yes. So that's why today I wanted to talk to you guys about MyOtalia and MyOSA for kids. Those are the ones that you guys can order. The
Awesome.
MyoBrace, like I was saying before, because it's you guys are probably familiar with regulatory issues at the moment with FDA and so on. If you say on the label that the appliance does orthodontic treatment, that's which is what MyBrace does. It says Myofunctional Orthodontics, straightens teeth. Then you have to be licensed to straighten the teeth. So you can't really use the MyObrace appliances because unless things differ in the US, but in Australia, myofunctional therapists aren't licensed to straighten the teeth. So that's why we
Mm-hmm.
restrict.
Same.
Same there. So we
Yeah.
restrict the purchase of MyObrace, but MyOSA for kids, Myotalia, you can buy them no problem because it's just for habit correction, which is what you guys do every day.
How far back does the tongue press tube extend posteriorly? That was one of the appliances that you were showing. I'm not sure if you'd like to share anything else, Anne.
So the tongue press tube here sort of goes halfway up the palate. So like I was trying to say before, it only really provides exercise for the anterior and middle portion of the tongue. So if you want the
Mm-hmm.
posterior portion of the tongue, you really want to be looking at the TLP. So the patient can
Okay.
actually push that as far back as they can and then exercise the back of their tongue. That's if you need exercise of the posterior thirds of the tongue.
Very good. The last question. We have a couple people asking about MyoBrace and about how to find a wrap in different countries, including India. Do you mind sharing with us if they're dentists interested in getting these appliances? Is there an email or a website?
Yep. So Renata, if you just don't mind sharing my screen again.
Mm-hmm.
So this screen here, I've put the regional contact number. So for most of you guys, you'd be contacting the US office. However, if you go on our website, myoresearch.com/contact, I'm just bringing this page up for you. So this is the contact page on our website. If you just scroll down to the bottom, you can fill in this form and just put your country in here. And it goes to the appropriate regional office who will then put you in touch with the dealer. I think we have worldwide, we would have close to 100 dealers worldwide. So it just depends on which country you're in. And we would then link you up with the appropriate dealer. So go to myoresearch.com/contact and fill out this form. Otherwise, you're welcome to email as well. Email customer service@myoresearch.com. We can help you. But this is the best way. You complete this form, and we'll link you up with the appropriate region.
Very, very good. Oh my goodness, guys, we are over time. I know that I have so many more questions over here to ask you, Dr. Ahmad. However, maybe we can set up another one of these lives to talk specifically about the MyoBrace. Do you guys want that? You guys let me know in
Yeah,
the comments or give us some hearts or um, some interactions over there to let us know if you guys would like for us to have one specific just for the MyoBrace. If you're not an Aries Circle member, join us. We're cool. It's so much fun. And plus, you get to stay, updated with all the latest research and what's going on in the area field. www.ariescircle.com/membership. You can do yearly or monthly. We have a foundations course starting. It's Foundations of Orofacial Myofunctional Therapy, starts August 1st. There is a wait list. I'm going to put right here in the comments the link for the wait list. If you guys are not on there yet, join us. And I have a new podcast, everybody. It's called the Beauty of Breathing Podcast. And you guys know who used to do this podcast. It was Dr. Martha Cortez and Jennifer Hobson. So it makes my heart warm to be able to be representing them well, bringing the Beauty of Breathing podcast back. So join us, click on there. Those are a little bit more, laid back discussions, 20 to 30 minutes, mainly for parents. So if you guys have a parent that cannot understand the A-Ray answers, because it might be a little too advanced, give them the link for Beauty of Breathing. And if anybody would like to be on there, I am looking for guest speakers. So come on over. And if you're not in our directory, we have over 500 professionals worldwide in our directory with 2,000 to 3,000 visits to our directory every month. So there are thousands of referrals being sent from Aries Circle. For that reason by itself, you guys should become members. Seriously, let's help these patients find the right professionals. So thank you so much, Dr. Ahmad Ahangary, for being here with us today. This has
Thank you,
been so
Renata.
eye-opening.
Thank
I
you so
have so
much.
many
Thanks
more
for having me on.
questions. Yes, but we'll see
Uh,
you next time. Thanks, everybody. Any last
Thank
words?
you. Yeah, I was just going to say if there's still questions, we can if you email or you go on that contact form or go to customer service at MyResearch or support at MyResearch, whatever you need, or even send them to Renata, she'll send them to
Okay.
me. I can answer every single question individually after this, no problem.
All right, awesome. Thank you so
All right,
much. We'll see you guys next week, guys. Oh, who do we have
all
next
the
week?
best.
Do I have the name? I don't know. Dr. Chan, we're on. Oh my gosh. You guys do not want to miss next week. Dr. Chang, he is, guys, he's unbelievable. We met him in Houston. He talked about AI, and oh my goodness, you guys are going to love him. Anyways, we'll give more information to you guys next week. Thank you. Have a great day. Bye bye.
Bye, guys. Thanks.